So here we have a kidney with the adrenal gland on top. The adrenal gland has two tissue types, the cortex and medulla, right? Outer cortex, inner medulla. The kidney itself also has an outer cortex and inner medulla, right? So the outer cortex is underneath the capsule, right? So the renal capsule is all this brown on the outside, and here it's peeled back. And the cortex also dips down between the medulla, and this is called a renal column. The medulla is arranged in pyramids, so this is a medullary pyramid. At the point of the pyramid, down here, it's called the renal papilla. Okay, so if we see this area, this is a large renal pyramid. Come down, that's the renal papilla. The renal papilla, the urine, which is made in both the cortex and the medulla, have nephrons. The urine is made, it drains into the renal papilla, okay, and then it drains into the minor calyx. So so the minor calyx is here. When two minor calyces come together and converge, you have a major calyx here. The major calyces will converge into a pelvis, this wide area, before leaving the kidney in the ureter. Okay. The blood vessels, renal vein, renal artery, follow renal artery in. Here's the first split. This is the segmental artery. Then as it goes between the two medulla, it's called interlobar artery. As it goes around, this is called the arcuate, and it goes into the cortex, and it's two names, cortical radiate or interlobular. Okay, so whichever one you want to use. Interlobular might be easier because there's an interlobular artery and also interlobular vein, so they have the same name. Okay, and then for the veins, the interlobular vein, arcuate vein, interlobar vein, and then, so if we go here, interlobar vein becomes the renal vein. So there's no segmental vein on the venous side. There's a segmental artery, but no segmental vein. Just interlobar all the way to renal vein. Okay, on this part, we have the cortex and the medulla, and we have the blood vessel. So this is an interlobar artery and vein coming up and around. This is the arcuate artery and vein. Here we have interlobular arteries and veins, or the artery can be called cortical radiate. Okay, so the balls you see are renal corpuscles. A renal corpuscle consists of a Bowman's capsule plus the glomerulus. This part coming off of the corpuscle is proximal convoluted tubule. Going down is the descending limb of the loop of Henle, ascending limb of the loop of Henle. This portion in the cortex will be the distal convoluted tubule. This side here, you can follow here, it goes proximal convoluted tubule, descending limb, ascending limb, distal convoluted tubule. They both converge on a collecting duct. So this is a collecting duct all the way down. Okay. So here's the renal papilla. Here is a minor calyx catching the urine being made. So let's see. I think that's it for that middle section. And the last section here, we have just the corpuscle cut in half. So we have Bowman's capsule. We have this area is the parietal layer of Bowman's capsule. This, the kind of peach color is the visceral layer of Bowman's capsule, which is also called podocytes. So I'll accept both of those answers. The knot of capillary is glomerulus. Here is the afferent arteriole. Here is the efferent arteriole. The afferent arteriole is cut open to show juxtaglomerular cells. The distal convoluted tubule is here. Here are the macula densa cells. The macula densa cells communicate with juxtaglomerular cells. So together with some mesangial cells between, which are not present, would be the juxtaglomerular apparatus. Here is the first part of the nephron. So this is the proximal convoluted tubule. You have cuboidal cells, and it should have really long microvilli that are not in this plaque. And that's this. That's the end. Thank you.